Today's discussion is about two important pharyngeal space. Number one, retropharyngeal space, and number two, para or lateral pharyngeal space. Right? Retro means behind. Pharynx, you know pharynx. Pharynx actually it starts from the base of the skull up to the cricoid cartilage. This is the extent of the pharynx, and below the cricoid cartilage, esophagus starts. Pharynx ends, esophagus starts below the cricoid cartilage. This pharynx again subdivided into three parts. If we introduce into a catheter into our nose, where it will touch posteriorly, that is the nasopharynx, as it lies behind the nasal cavity. If one probe is introduced through your mouth, it will touch posteriorly. That part is oropharynx, as it is behind the oral cavity. And third one is behind the larynx. This is the laryngeal cartilage. Behind it, the part of the pharynx is called laryngopharynx. Right? Now, retropharyngeal space means that space which lies behind the pharynx. Right? Now here you see, this is the esophagus, and this thing, it is actually a constrictor muscles. There are three constrictor muscles around our esophagus. One is superior constrictor. This is the superior constrictor, middle constrictor, and lower constrictor. Now this constrictor muscle actually they overlap each other. If we draw like this, suppose this one is the superior constrictor, this one is the medial constrictor, and this is the lower constrictor. In this way they actually overlap, right? So this is the constrictor muscles. Now to describe any space, you have to describe the boundary. Now, if we trace above it is the roof of the roof of this retropharyngeal space is formed by the base of the skull. Upper limit is base of the skull. This is actually sphenoid bone. This is sphenoid bone. You know, sphenoid bone forms the part of the base of the skull, so it is the base of the skull. Now, from this base of the skull, the one fascia descends. One fascia descends and it divides into two. Here you see, it has been divided into two. This fascia which lies in front of the vertebra, that is prevertebral fascia. I have already talked about prevertebral fascia. This prevertebral fascia extends how much below? It extends up to the T3, thoracic third vertebra. In some book it is written up to the thoracic fourth. So you should write thoracic, one level you should remember, that is thoracic third vertebra. Right? তাহলে up below extension limit হচ্ছে third T3 thoracic vertebra, and it has divided into two. Anteriorly this part, prevertebral fascia, is known as alar fascia. Alar fascia. This alar fascia actually lies, this constrictor muscle actually covered by, this constrictor muscle is covered by buccopharyngeal fascia. So this part, alar fascia, is actually blends with the buccopharyngeal fascia. Now this is space. This is space is the retro. This is the pharynx. This esophagus is a part of the pharynx. Here pharynx ends and esophagus begins. So that part is the pharynx, and pharynx is covered by constrictor muscles, 3 constrictor muscles from above, below, 1 to 3. So this part behind the pharynx, this part is known as the retropharyngeal space. Right? Now this space below its extension below is open. Below this space is open, and it is continuous with the superior mediastinum, thorax. So this space is continuous with superior mediastinum. Right? Again I am repeating boundary. Anteriorly it is the buccopharyngeal fascia which covers the constrictor muscles. Behind prevertebral fascia, extension up to which T3 vertebra. Right? Now laterally, if you want to understand the lateral extension, you have to take the horizontal section. Here you see, this part is the retropharyngeal space. Laterally actually lies this part. It is known as carotid sheath. Carotid sheath. Right? So this is the carotid sheath. Laterally it is formed by the carotid sheath. So this space is the retropharyngeal space. Right? বুঝতে পেরেছিস? Boundary above base of the skull, below it is open. In front, buccopharyngeal fascia covering the pharynx. Behind, it is the prevertebral fascia. Right? Now, I am coming later on, after describing the lateral pharyngeal space, I will discuss the applied importance. Right? Now come to the another space that is called lateral pharyngeal space. It is also known as parapharyngeal space. Para means by the side of, pharynx means by the side of the pharynx. Here you see, this part is the part of the wall of the pharynx. I have already told you that pharyngeal wall is formed by the constrictor muscles. Here this thick part is the constrictor muscle, superior constrictor muscles, and it is the within the oral cavity, and on the oral cavity this part is the palatine tonsil. If you see your palatine tonsil and if you introduce a probe through the palatal tonsil, it will pierce laterally the constrictor muscle, that is middle constrictor muscles. And outside middle constrictor muscle lies the buccopharyngeal fascia. This is the buccopharyngeal fascia. Right. Now this space is known as lateral pharyngeal space. Now medial boundary হয়ে গেছে, medially it is formed by the wall of the pharynx. Now laterally what lies? Laterally, anterolaterally this part is the medial pterygoid muscle. Medial pterygoid muscle actually, when you will study the mandibular angle of the mandible, উপরটা হচ্ছে ramus of the mandible, that ramus of the mandibular medial surface actually gives origin to the medial pterygoid. So it is the medial pterygoid where it lies anterolaterally, and posterolaterally lies parotid gland. This is the parotid gland. This one is the parotid gland. So posterolaterally lies parotid gland, anterolaterally lies the pterygoid muscle, right? And behind lies the carotid sheath. So this is the boundary of the parapharyngeal space. Medially, lateral wall of the pharynx, or laterally, again anterolateral, posterolateral. Anterolaterally this is the pterygoid muscle, medial pterygoid muscle, and posterolaterally this is the parotid gland. And you know parotid gland is covered by which layer of the sheath? Investing layer. তাহলে posterior layer of the, here lies the posterior layer of the investing layer of the cervical fascia, right? So this is the boundary of the lateral pharyngeal space, right? বুঝতে পেরেছিস? Now it will come as a short note. Generally broad question আসে না এখান থেকে, as a short note যদি আসে এটুকু লিখবি. Then most important thing is the applied importance. What is the applied importance? Applied importance is, if there is this space, this retropharyngeal space, here lies some lymph node. And this retropharyngeal space actually it is fixed by a fibrous tissue. So any inflammatory exudate will not be able to come over here because of this fixation. The posterior wall of the pharynx is attached to the prevertebral fascia by fibrous tissue. So it is actually divided into two compartments, right? If this compartment is involved due to infection, if there is an infection, pyogenic infection means that infection which will produce pus. If there is a pyogenic infection of the lymph node, the lymph node will be enlarged. That enlarged lymph node will expand anteriorly or posteriorly. Posteriorly it is the vertebra. So it is not possible to push vertebra. So it will anteriorly push. So this wall will be like this. This wall will be like this. There will be a swelling. As an ENT specialist, when you will see through the mouth, you will find that one paramedian swelling is present. Patient is complaining of pain, and one paramedian swelling is present. Then you will think that it must be infection of the retropharyngeal space. right? Then you will cut, will incise and drain the pus. Sometimes another infection, that is it is called pyogenic abscess. Pyogenic abscess means forming the pus. In acute infection, what happens? In acute infection, what are you talking? In pyogenic infection, when it will be acute, there is some criteria. You will study it in your pathology class. One of the criteria of acute infection is it will produce swelling, it will produce pain, it will produce heat. It is hot abscess, and another abscess there, that is called cold abscess. What is cold abscess? In cold abscess you will not get this criteria. Pallor, dolor, calor, infection, you will not get it. As it is cold, so it is not, there will be no rise of temperature, and that cold abscess actually it is the median swelling, and cold abscess is formed by cold abscess is formed by Carey's spine. What is Carey's spine? Carey's spine means when vertebra will be involved, that is called Carey's spine. When vertebra will be involved by tuberculous infection, it is called Carey's spine. Cold abscess means it is due to the tuberculosis, and where it will form the swelling, and it involves the vertebra. So here it involves the vertebra here. So here it will produce pus, cold abscess. So it will produce this. It will push this prevertebral fascia. It will এটাকে ঠেলে দিয়ে ঢুকে যাবে. I have drawn big gap, but there is no such big gap. It is potential space. So it will produce a midline swelling. If you see through during inspection of the mouth cavity on the posterior wall of the pharynx, if you see a median swelling which has got no acute feature, that is called cold abscess, then you will consider that it must be due to Carey's spine. Then you will investigate other investigation of the Carey's spine, and you will reach diagnosis and will treat. If there is cold abscess, Carey's spine, which will form median swelling, and if it is acute infection, acute abscess, which will form paramedian swelling. Clear? Clear, sir? Now, this infection also may spread laterally also. It is not only to the anterior posteriorly, it may also laterally extend. When it will laterally extend, suppose this Carey's abscess, cold abscess, when it will laterally abscess, which will pass behind the carotid sheath, and behind the carotid sheath, it will appear behind the posterior margin of the, this is the sternocleidomastoid. So it will appear behind the posterior margin of the sternocleidomastoid, right? Then you will get swelling, cold swelling at the posterior margin of the sternocleidomastoid, means posterior triangle. Posterior triangle bound to janish. So cold abscess here means you will think about the Carey's spine again. Anteriorly, generally it cannot spread. It generally, there is some space behind the carotid sheath, so posteriorly it will spread. Right? So this is the lateral spread. And if it spreads below, where it will go? Retropharyngeal space is continuous below with, এখানে আমি দেখিয়েছি, below it is continuous with the mediastinum. So there will be mediastinal involvement. Thoracic cavity, mediastinum will be involved. So these are the different routes of the spread of the abscess. retropharyngeal and parapharyngeal. Now come to the parapharyngeal space. Here you see parapharyngeal space. Here, this parapharyngeal space generally involved due to the involvement of the tonsil. You will get many patients who will suffer from tonsillitis. So tonsillitis may spread laterally to the parapharyngeal space. From parapharyngeal space, sometimes this infection may involve the floor of the mouth. Floor of the mouth. If floor of the mouth is involved, it will form swelling below the chin, as well as you will find the swelling within the mouth cavity. If you see inside the mouth cavity, it will form the swelling within the mouth and it will produce swelling below the chin here. That is called Ludwig's angina. Ludwig's. L-U-D. Ludwig's angina. If it may compress the airway. Ludwig's angina, if there is Ludwig's angina, it may compress the airway, so the patient will complain of suffocation. Then what will you do? If patient comes with suffocation, with Ludwig's angina, what will you do? To save the life of the patient, you have to tracheostomy. এখানে একটা tracheostomy করতে হবে, না তো পেশেন্ট তো চোকিংয়েই মারা যাবে, বুঝতে পারলি? So Ludwig's angina is a very serious condition. So you should keep it in mind that it may compress the airway and patient may die of suffocation. That Ludwig's angina actually it comes as an extension of the infection of the lateral pharyngeal space. Right. So these are the two important space. Right. Clear conception, clear. পরীক্ষা হলে লিখতে পারবি তো এবার? আবার বলতে হবে? আবার রিপিট করতে হবে? হ্যাঁ? আচ্ছা, parapharyngeal. Para means by the side of the pharynx. So one of the boundary will be pharynx. তাহলে medial wall, this is the medial wall. This is the medial wall of the pharynx. এখানে কি আছে? এখানে আছে তো buccopharyngeal fascia covering the constrictor muscles. Pharynx-এ সবসময় আউটওয়ার্ডলি constrictor muscles থাকে। তাহলে অত যদি না মনে থাকে, বলবে medial wall is formed by the pharyngeal wall. Right? At the level of the, যদি বলিস at the level of the tonsil level বলতে পারিস। And laterally anterolateral and posterolateral. Anterolaterally lies pterygoid muscle on the medial aspect of the mandible. এটা কি বললাম, কি প্রসেস? ম্যান্ডিবুলেটের প্রসেস কি বললাম রে? একই নামে দুটো আছে। এইখানে একটা বোনস আছে, কি বোন বলতো? এটা হচ্ছে কি বলে, রেডিয়াস অ্যান্ড আলনা। আলনাতে কি প্রসেস আছে? হ্যাঁ, আলনাতে কি প্রসেস আছে? অলিক্রন আর সামনেটা কি? What is the name of the process in front? Coronoid process. ঠিক বলেছিস এবার, বুঝতে পারলি তো? So on the medial aspect of the mandible, there is near the angle of the mandible, on its medial aspect, there is a muscle that is called pterygoid muscle. Medially lies pterygoid, আর laterally থাকে, দেখেছিস তো laterally যে মাসলটা থাকে, ম্যাসেটার। পোস্টিরিয়র ট্রায়াঙ্গেল ওই ফেসে দেখিস নি? ফেসে দেখেছিস তো? ঠিক তার অপোজিটে this is the masseter, and just medially lies the medial pterygoid. This medial pterygoid, masseter, lateral pterygoid, and this here is muscle here, that is called temporalis. These four muscles form the muscle of mastication. মনে থাকে জানো? Muscle of mastication, there are four muscles. One is temporalis, One is masseter, just deep to masseter on the medial aspect, medial pterygoid, and lateral pterygoid. These four muscles is known as muscle of mastication. They are supplied by mandibular nerve. Mandibular nerve is the nerve of the first arch, and these দুটার আর্চ তো হয়ে গেছে, ফ্যারিঞ্জিয়াল আর্চ তো পড়ে নিয়েছিস তো, তাহলে ফ্যারিঞ্জিয়াল আর্চ, ফার্স্ট ফ্যারিঞ্জিয়াল আর্চের নার্ভ হচ্ছে ম্যান্ডিবুলার নার্ভ। সো দিস অল মাসলস উইল বি সাপ্লাইড বাই দ্য ম্যান্ডিবুলার নার্ভ। এরকম মনে থাকবে, এগুলো খুব মানে কী বলে, খুব মানে এই কোশ্চেন আর কি, খুবই জিজ্ঞাসা করার পরীক্ষাতে, বুঝলি তো, ভাইভাতে জিজ্ঞাসা করবে এগুলো। হলো তাহলে অ্যান্টেরোল্যাটারালি medial pterygoid, posterolaterally parotid gland, and posteriorly and একদম posteriorly lies carotid sheath. It is an wedge shaped space. Wedge মানে এরকম, it is an wedge lateral মানে parapharyngeal space বা lateral pharyngeal space is wedge shaped space. Wedge মানে এরকম দেখতে। Its upper end is directed above, that is the base of the skull. Below it extends up to the hyoid bone. Hyoid bone, বুঝতে পারলি? তাহলে এই গেল তো ল্যাটারাল ফ্যারিঞ্জিয়াল স্পেস, হচ্ছে। এবার আমি পুরনো আগের দিনের কোশ্চেনগুলো আমি জিজ্ঞেস করবো। আগের দেয়ার আর থ্রি ফাসা, তিনটে ফাসা আছে আমাদের নেকে, মেন তিনটে ফাসা থেকে আবার ডেরিভেটিভস আছে। মেন থ্রি ফাসা ইন দ্য নেক, কি থ্রি ফাসা ইন দ্য নেক? ওটা তো ডিপ সার্ভাইকাল ফাসাই তো কথা বলছি। ইট হ্যাজ গট থ্রি লেয়ার। কি মিস্টার? পড়ে না, বাহ, ভেরি গুড, ফাইন, থ্যাংক।